class and Dr. Kenzick. My name is Nicole Coleman, and I'm going to be presenting to you on modifying firearm usage to reduce perpetual violence in Black males living in low-income communities throughout America. I hope you find my presentation to be informative and inspirational, and I'm excited to present to you guys, so let's go ahead and get going. So population, health outcome, and behavioral focus. The population is young Black males, ages 15 through 24, living in inner city communities in America. Our health outcome is incarceration rates, and our behavioral focus is the use of a firearm to perpetuate violence. The use of firearms to perpetuate violence amongst young Black males. Firearm homicide among Black boys and young men ages 15 through 24 was at an outlier level, many times greater than the rates of any other demographic group, developmental stage, or violence intent, particularly in urban settings, and it's cited right there. Higher rates of incarceration were associated with increased rates of firearm homicides among Black communities alone. This association was found to be mediated partially through the density of single-parent households in these areas, suggesting that social disorganization resulting from mass incarceration may perpetuate firearm homicide. And I have this graphic right here. The likelihood of being impacted by gun violence is influenced by your race, age, gender, and zip code. And I just felt like it was really relative to this literature on the left-hand side explaining how a lot of the factors, the outliers that influence firearm usage amongst black boys and young black men is, tied to just socioeconomic demographics, age, gender, race, zip code, and them just being at a disadvantage due to these things. Some risk and protective factors that can influence this behavior. So risk factors on the individual level: firearm possession and weapon use. So those that possess firearms, whether it be legally or illegal, and use them to perpetuate violence, that can influence that. Criminal legal system interaction. So these young Black men and adolescents that are having run-ins with law enforcement, whether it be for a traffic stop, whether it be for possession of like a substance like marijuana, whether it be just for racial profiling. A lot of times these interactions tend to cause a level of hypervigilance and hypersensitivity in Black men, and it does kind of prompt them to carry firearms just to, kind of as a sense of protection and security. Also substance use, so using uncontrolled substances, that can also create an increase in this behavior. On the relational level, gang membership and gang activity and exposure to other people who have experienced a firearm assault. On the community level, indicators for socioeconomic status and racial residential segregation. And on the societal level, historical racist policy. These all are risk factors for firearm usage to perpetuate violence. Some protective factors: community violence exposure programs and peer victimization. Social determinants that are related to this behavior: intergenerational internalized hurts and pain from slavery, cultural oppression and alienation, systemic racism, and institutionalized racism. So as you can see, a lot of this behavior that you see within this community goes back to just the disparities and disadvantages that African Americans have been exposed to in America, and a lot of it is just ramifications from the inequalities and inequities that exist since slavery and even after its abolition. So application of ecological models for intervention effectiveness. On the individual level, exposure and victimization to firearm violence, barriers to supportive service for victims of firearm violence, distrust in law enforcement, and substance abuse. So kind of going back to what I said on those previous slides, a lot of times if young Black men are exposed to firearm violence or have been a victim of it, that increases their likelihood of going on to carry out that behavior. Also a lack of access and resources to these individuals that have been victims or victimize others. There's not a lot of rehabilitative services nor are there peer support groups to help them process the emotional and mental and physical, pain and aftermath of what they've experienced. Also, the distrust in law enforcement within this community, just the stigmatization that comes from Black men, a lot of times, unfortunately, at the hands of law enforcement, and also substance abuse. So, just the I'm sorry, I can't think of my word. The amount of just access and abundance of uncontrolled substance that circulates in these communities. On the interpersonal and relational level, disproportionate rates of intimate partner violence and victimization in one's social network. So a lot of times there is domestic violence within the home between parents or within romantic partners. And this is also exposing youth to firearm usage, and they're learning to adapt this behavior as a means of security and protection. Victimization in one's social network. So a lot of times in their groups, they're seeing their peers be targets of firearm violence, and a lot of times out of retaliation or as a byproduct of just hypervigilance from experiencing these traumatic events. Young Black men and adolescents go on to perpetuate firearm violence just as a means to cope and just move forward. On the community level, elevated exposure to firearms and firearm violence, increasing policing in Black neighborhoods, increased gun access, residential segregation, and racial bias from neighbors. On the societal level, historical racism, structural disadvantage, and social inequalities. The behavioral theories that are applied, the health belief model, which focuses on perceived severity, perceived susceptibility, perceived benefits, perceived barriers, youth to action, and self-efficacy. The socio-ecological model, which focuses on policy, community, institutional, interpersonal, and individual levels. The social cognitive and social learning theory, which focuses on observational learning, reinforcement, self-control, and self-efficacy. And the theory of planned behavior, which focuses on the attitudes towards behavior, subjective norms, perceived power, perceived behavioral control, and behavioral intentions. So these are some of the studies that I used for my research. So when discussing the health behavior model, it was found that the health behavior model can be used to shift behavior and firearm usage amongst young Black men and Black adolescents. And a lot of times legislation that is backed by Black representation, so by Black legislators on the community and state and federal levels, this can cause a reduction in firearm behavior. On the socio-ecological model, so the socio-ecological model can be used to develop equity-based violence prevention programs. The social cognitive theory and social learning theory, there was some success with these theories, but they failed to account for the role that gender plays in violent behavior. So there needs to be some more research done on that, and it also failed to account for the role that protective factors have in preventing firearm usage. There was a lot of research done on the risk factors, but not much done on the preventative factors. And the theory of planned behavior provided a successful framework for the development of violence prevention programs. So some interventions that I thought would be successful using the social cognitive and social learning theory: peer support groups. So a lot of times perpetuators of firearm violence are often victims due to exposure or victimization themselves. Having peer support groups and just creating a safe space for these individuals to be able to bond and share their experiences with others that look like them and live in environments that are similar to them and can really help them process what they're going through. A lot of times in these communities, they're so used to seeing firearm violence that they become desensitized to it, and it impacts their ability to be able to process these things, and confide and trust other individuals and be able to find healthy coping skills to work through these things. Mental health symposiums, community-based forums that provide in-person support groups and professional expertise to help young Black males navigate their environments and develop healthier coping skills that increase self-efficacy and self-control to regulate emotions better. With the mental health symposiums, I think that community-based forums that provide in-person support from mental health professionals, a lot of times these communities are underserved and they don't have the resources to even reach out to mental health practitioners to help them process what they're going through and help them come up with treatment plans to cope with the stress and the just emotional and mental disruption that comes from just firearm violence. So I felt that this would be something that could be helpful in just helping increase self-efficacy and self-control to just, like I said, regulate emotions better. And when you are presented with a challenging or threatening situation, just having the skill set to be able to regulate yourself and just come down out of your fight or flight and just process things civilly without resorting to violence. Community partnerships, so scheduling interactive visits to schools, recreational centers, and libraries by local law enforcement, nonprofit organizations, regional and state legislators, correctional officers, and rehabilitated victimizers to educate young Black males on firearm usage and the emotional, mental, and physical dangers associated with the behavior. I think a lot of times with these type of populations, they're reached best by bringing in people that look like them and have experienced the same things that they're going through. So I think that it would be very helpful to have these type of interactive experiences with law enforcement, nonprofit organizations that focus on rehabilitating, former inmates as they adjust back to society upon their release, and also regional and state legislators, and really prioritizing Black representation, so that these young Black men can see that there are people that look like them that are working in the political realm to help reduce these type of disparities and these type of public health crises that are plaguing their neighborhoods. And also to just having rehabilitated victimizers come in and speak and really sharing how gun violence and firearm usage has ravaged their lives and the trauma and pain that it's caused to them and others that are close to them and that they love. I think that would be very helpful in just mitigating some of the just trauma that comes with this topic and with this discussion. Some ethical concerns, obviously confidentiality. Gang activity is heavily associated with the use of firearms, so creating an environment that fosters trust and open communication with the population may be challenging. I do think that there would be cause for concern that some individuals would be a bit skeptical in participating in the mental health symposiums or joining a peer support group just out of fear of potentially being in a support group with a rival gang member, or feeling that it's a loss of like street credibility to be seen needing emotional support. And I think that it would be really important to breed a space of confidentiality where people can join these groups and not feel judged or feel as if they're going to be kind of like outed for their affiliations or activities and things. Participants may feel coerced into attending symposiums or peer support groups due to their affiliations or perceived stigmatizations based on their demographics. So a lot of times, they are going to schools and they are hanging out with peers that are engaging in these type of behaviors. And a lot of times they might feel coerced by teachers or by faculty or by parents or other caregivers to participate in these type of intervention programs by force and not by choice. So that's obviously an ethical concern that we'd have to be aware of. And also the potential for harm. Firearm violence is a sensitive topic that many can relate to in some facet. So there is potential for these conversations and interventions to trigger mental, emotional, or physical distress. And obviously with that, just wanting to make sure that people are readily consenting to participate, and that if there is any type of trigger of mental, emotional, or physical distress, we have resources on hand to help individuals cope and process through that. In conclusion, theory-based intervention programs are successful in reducing firearm use to perpetuate violence and incarceration rates among young Black males. Theory-based interventions help us understand the social and structural determinants that plague Black males and predispose them to firearm usage as a form of protection and a means to survival. Support and engagement at the local, state, and federal levels to reduce racial and socioeconomic inequalities can radically improve the trajectory of Black males being disproportionately affected by firearm violence. Thank you guys for listening and watching, and I look forward to your feedback. Have a good rest of your evening.